since 1980, we had a flurry of good studies come out. And it's based on those good studies that the AAP and ACOG and WHO came out with their recommendations. But we didn't even have the data until 1980. Okay, so here's some of the data. We're going to look at three groups: the term baby, the preterm baby, and the mother. The term baby I'm defining as a baby who's born at between 37 and 42 weeks gestation. You know, people talk about normal gestational age being 40 weeks, but we define in the medical community term 37 to 42 weeks of age when they're born. So for the term, this is the term baby now. Does it matter if what the baby's fed? So I'm going to divide this room right down the middle. You guys come into me pregnant, you come into your significant other, we sit down, we talk. I'm a pediatrician, we talk about a lot of things. We talk about getting a car seat and do you want a circ and do you want shots? Then we talk about the feeding choice. You're fully informed and you guys decide to breastfeed and you're successful at that. You guys come in, you're fully informed and you decide to formula feed. Let's take a look at outcomes of your babies for certain illnesses. Simply based, the only variable here is what you feed your baby. So you guys are the breastfeeding groups. We know that you guys are going to have 50% more ear infections, your babies, in the first year of life. Sorry, 50%. Formula feeders at risk for ear infections compared to you. Your babies, the formula feeding side, have 5 times the risk of developing gastrointestinal illness, so that's vomiting and diarrhea in the first year of life. So, what's the big deal? These are bread and butter pediatric things. You know, the kid will get out of it, so not a big deal. Pain in the neck. However, this has significant impact on things that have big public health issues. So we know that your babies over here, the formula-fed babies, you guys have significantly more lower respiratory tract infections, so like bronchiolitis or pneumonia. 35% more of your babies will be considered obese going into kindergarten. And we know that the obese kindergartner will be the obese adult who is at risk for diabetes, heart disease, arthritis, all of those things. There is a direct correlation between how much the baby is fed formula and their risk of being obese, to the fact that the CDC just published guidelines on how we're supposed to address this childhood obesity epidemic we have going on. And their first thing, number one, promote and support breastfeeding, because the data is so strong about this link to obesity. So now let's look at the preterm babies. These are babies that are born before 37 weeks gestational age, but they could be 29 weeks. They could be the tiny, tiny micropreemies that are in the NICU. Now, I can stand here and I can say they need to get breast milk to save their lives, because we know that breast milk for tiny babies decreases the risk that they're going to come down with an illness called necrotizing enterocolitis, and that's a condition that only preterm babies get. And for some reason, parts of their bowel infarct and die, and they have to have major surgery, and they have to have big loops of their bowel taken out. And we know that if these little babies receive breast milk, their risk of getting necrotizing enterocolitis, look at how much it goes down or goes up depending on what they're being fed. So babies in the NICU must get breast milk. To the extent now in California, they have milk banks out in California. Neonatologists are writing prescriptions now. They're treating banked breast milk as a medication for these NICU babies. And then I want to share with you this data for preterm babies, which the last study here, enhanced brainstem maturation, this study was done at the University of Rochester. They looked at babies who were born at 32 weeks gestational age. They compared those babies that were getting breast milk to babies who were getting formula. And they followed serial or weekly bear exams. This is an examination that you do that you can measure the maturity of the brainstem. And they found that the babies that got the breast milk, their brainstems matured faster. And the reason for that is breast milk contains these little globules of fat, and in the fat are these very, very important free fatty acids that are vital for babies' cell membranes in their retina and their brains to grow.